So we're still a bit waiting a few minutes longer. 40 people arrived, but 19 participants registered. So we'll wait some extra minutes so people can arrive.
Is it you that will forward the slides?
Yeah, I will go to the slides.
Okay, thanks.
So welcome to the new people attending. We are 50 now. We are still waiting 2 minutes extra so everybody can join the session, and then we'll start in 2 minutes. All right, I propose we will start. Good afternoon, everybody, and welcome on this seminar organized by the Belgian Diabetes Forum. We are many today, so we really want to thank everybody for your enthusiasm and interest in participating in our today's session. And of course, we also warmly want to welcome our international guests who will speak later during this session. The topic of today, as you know, of course, very well, is about data and how data will or could help us in fighting chronic diseases. And of course, in here, this today, diabetes will serve as a case. I will present you the agenda of the session. You know, we have 19 minutes for our seminar, and in a couple of seconds we will have an introduction by our president, Professor Nobles. And then Professor Crenier will also tell us some more about the importance of data indeed. And we are also very happy to give the floor to a person with diabetes, Ms. Roskams, also welcome, of course. And then we are also super happy to have an international, I would say, panel which will share us their good practices in Scotland and in Sweden. Professor Mathieu will also introduce them. And then we'll conclude with our own actions and visions on the data topic here in Belgium. And then very important, we want to start the discussion and listen to your suggestions let's say, in the second part of our session. Some practicalities maybe during the presentation. You can easily, of course, use the chat to put your comments or questions in. Myself and my colleague, we will read them and, of course, put them, ask them to the speakers. For the second part, you can also raise your hand and intervene directly in the session discussion. This session is also recorded for your information. And that brings me then to the official kickoff of this session. And I will present, I'm happy to present Professor Dr. Frank Nobles, who is head of the Endocrinology Diabetology Department of the Onze Lieve Vrouw Hospital in Aalst, but also visiting professor at the KU Leuven, Catholic University of Leuven, also honorary president of the Diabetes Liga, and Professor Nobles is our current president of the Belgian Diabetes Forum. Please, Professor Nobles, the floor is yours.
Hey, good afternoon. I'm very happy that so many people are interested in the topic of this afternoon, the data gathering and management in diabetes. And unfortunately, we are still in tele mode, but in fact, this gave us the opportunity to invite interesting people from abroad, from Sweden and Scotland, that you will hear further on, and that will inspire us with what they already did in their countries around data management. I want to kick off by giving you first an introduction on the purpose and actions of the Belgian Diabetes Forum. You all know that Belgium scores high when it concerns complex diabetes care. We have excellent organization systems, the conventions, the diabetes care pathways. We have an excellent quality enhancing initiative in the conventions, namely ECAT, that Laurent Grenier will present you also, with benchmarking and quality circles that allowed us to improve our diabetes care over the many years, and allows us also to compare with other countries, and we can be proud that we compare very favorably. But anyone who works in the diabetes field knows that there is much that can be improved, really essential things that should be improved, because diabetes is a too important disease to ignore these things. So we should really try to further improve diabetes prevention and diabetes care for the sake of people with diabetes and their families. And that's why we joined forces in late 2019 with several stakeholders to create the Belgian Diabetes Forum, where we really want to build a common ground between all people that are important in diabetes prevention and care. And we want to be an open forum, and we want to hear all voices that are important in the diabetes world, and that's why we organize meetings such as this meeting this afternoon. And we are ambitious. We want to advise and support policymakers, but we want to do this in a sensible way, because we, of course, know that the sky is not the limit. The budgets are of course, limited, and we know that there are other diseases than diabetes, but we are convinced that there is a lot of enthusiasm in the diabetes world, and that you could use this enthusiasm to pave the way also for other chronic diseases. So we are really willing to look from a generic perspective and use diabetes to also help other chronic diseases. One of the first activities, next slide, next slide, Philip, yes. One of the first activities we organized with the Belgian Diabetes Forum was to draft a white paper, and Philip's team from White with an Ypsilon did extensive field work, interviewing as many stakeholders as possible in the diabetes world, and draft their opinions into that white paper that you can download from our website. The next slide, we had several fora to discuss about the content of this white paper, and this allowed us to draft 9 recommendations of the forum for the Belgian policymakers. And further discussions, next slide, allowed us to put forward 3 priorities that we think are realistic to put into practice in the next years. And I will start with priority 3. Priority 3 is to organize care as a true team effort, so focusing on integrated care and especially on primary care, because we think this could be improved a lot. Priority 2 is empower people with diabetes. This is, of course, a very important priority, and we think we should be creative and use also digital technologies to empower people with diabetes. And priority 1 is the priority that we are focusing on today, is designing a good data management strategy for diabetes. And I'm happy that we have several experts around this afternoon. So we will, the purpose of this afternoon is really to get deeper into this topic, to focus more, that we can be ready to get ready to advise the policymakers around this topic. So we can immediately kick off. I will give the floor to Professor Laurent Crinier. Laurent is Prof at the ULB, is head of the Diabetes Department of Hôpital Erasme, and is president of the Diabetes Association, the Association du Diabète. Laurent is a very active researcher and clinician, and I'm sure that he will convince you that collecting data in diabetes is really essential. And he will also show you that the Belgian diabetes community already has a tradition of creating databases and use these databases to try to improve diabetes care. Laurent, I will give you the floor.
Thank you, Frank. Indeed, collecting data in chronic disease is very important. Next slide. And before all, because you know that chronic disease gives us a very tough challenge, and because you know that chronic disease are frequent in our countries, that they often, and especially with diabetes, they require specific multidisciplinary approaches. And of course, they are responsible of most of the mortality still now in our country. If you are still alive, you may also have a reduced quality of life, many other comorbidities, and finally, for the policymaker, the chronic disease are one of the main causes of the medical healthcare spending. So all of that, of course, make that to know this disease and their comorbidities is very important. Next slide, please. As you see here, the data from Sansano, recent data from Sansano say that in Belgium, in the top 10 specific causes of death, you may count that 6 are chronic illnesses. Of course, diabetes is one of them. And with the difficulty that diabetes may also be an indirect cause, also with obesity, that is often associated with diabetes, of cardiovascular disease, cancer, and cirrhosis. So maybe that diabetes should be ranked even on top of where it is for now. Next slide. And so this is very important to get data in chronic disease, but what to do with this data? So maybe you know that, so sorry for that, but I will remind you the basics. The basics is that we need data to monitor change in prevalence. That means the total number of cases in a region or the country, and also even more important, the incidence of the disease. That means the new case, how much new case per year we get in Belgium, for instance. Knowing that, we may also observe the course of the disease, the evolution and outcome with different treatment and technology. That's very important, that because you know, especially with diabetes, we have a lot of new treatments this last year and also a lot of new technology to test. Of course, and we will see an example of that. We may measure the quality of care in the country or in different areas. And finally, identify factors that influence outcome and quality of life. Next slide. So that was for the basic. If then we want to go further, we may construct some data registries. And data registries may bring real-world healthcare data that are not easily accessible or inaccessible from clinical trial. I'll show here some example. For instance, you may test new healthcare policies for specific outcome and use a registry for that. You may access the quality of care and the access of patients to health service globally or in some regional parts of the country. You may monitor cost effectiveness of care of medical technology and medication on the long term. And that is also very important because a clinical trial usually do not study the long-term effects of medication. And of course, it is also very important for the patient side to get data about quality of life, comorbidity, and so on. You may also identify subgroup of patients, for instance, subject with frailty, subject who need specific care, etc. And finally, maybe Chantal will have a word about that. The national registry may be part of more global registry, as for instance, as the European level. Next slide. So this is a sample, an example of what can be done and what is done in Belgium with a project that we call ICET, so a project about the quality of care in patients with diabetes treated with complex insulin treatment. That means more than 2 injections of insulin per day. And so we take in all the center that we call in Belgium the convention center, all the center managing this patient, type 1 and type 2 patient of insulin. We take a sample of 10% of the population. The audit is performed every 1 or 2 years. And then the data are processed by Sciences, that is our public health scientific institute. And this data will be used to get some benchmarking. That means that the center get the feedback of what they do with the patient. They may compare with other centers. Of course, it's anonymous, but for instance, you may compare the hemoglobin A1C of your center with other and many other data. I have no time to show you that. And of course, it could be used as a quality check for each center. We have also very interesting epidemiological data, cross-sectional and longitudinal, but I have no time to get about that. Next slide. So what is an example of what has been published with this data? You see here on the left the well-known type 1 diabetes registry in the US. That's the type 1 exchange data registry. And on the left, on the right, sorry, next slide, next push, voila. You see exactly the same data in Belgium. So you may see first that there's a lot of improvement to be done in US, also probably in Belgium, but we can say that maybe that our patients in Belgium are not so badly treated as maybe we are even a bit better than in US. And especially you may see by comparing the red, green and blue curve that the things are improving in Belgium. So what is the kind of data we already have for some sample of our patients? Next slide. So, as I just showed you, the ICET initiative is probably one of the proof of the excellence in terms of analysis of data from chronic disease in Belgium, but there are still gray areas. A matter of fact, you know that there are no systematic registration of diabetic patients in Belgium, so it could be seems astonishing, but in Belgium, at now, we don't know what is the exact number of diabetic people living in our country, and even maybe more important, we don't know well the incidence. That means so the new case of people with diabetes in our country. Of course, we have some guesses. Our mutual health funds make estimation, but this is always based on medication prescription, which is of course not the best way to do. And first thing to know is that a lot of patients are underdiagnosed or even not treated. So it is, of course, biased. Next. And we think, however, that these numbers are really mandatory if we want to build any wise long-term health policy. Next slide. So we have some example of already successful registry in Belgium. One which is well known is the cancer registry. And I think the key words of the registry is that the registration of new patients with cancer is a legal obligation in Belgium, so it is mandatory. We have most of the patients with cancer, and so because of that, we may see very well known, very well done trends, incidence, survival, prevalence, and mortality curve with cancer that we don't get with diabetes for now. Another keyword is that these data are processed and used with great care and regard to privacy protection. I think data protection is also very important, especially when we ask the opinion of a patient. Next slide. So in conclusion, we think that diabetes is a great opportunity to launch data pilot projects in Belgium. Why? First, because numerous data sources already exist. I show you it, but Frank will talk, we talk about a lot of other data. And so this is something that we have to take and to make profits of. Secondly, structure have already been built. I give you a word about the diabetes convention, but with also what we call ZOR trajectory, the diabetes trajectory, the Curie trajectory, and so a lot of structure already exists in Belgium. This structure may be used to facilitate data collection, but they may also be used to evaluate the policy making and probably to support translation to other diseases. Diabetes registry abroad have proved the feasibility and almost above all their usefulness, and we will see two great examples with Sweden and Scotland in a few minutes. And finally, maybe that the Belgian Cancer Registry could be an inspiration in regard to health data privacy protection. So that was my conclusion. And as we want to stay on time, I will now give the word to Miss Maartje Roskam. So Maart is a diabetic person, but she's above all, she's a nurse. And this is very new because she told me that she's nurse from only 24 hours. So I think we may congratulate her for this graduation. She also a top athlete, as we know that she's ambassador for Climbing for Life. She also a young leader in diabetes, and she's also very implicated at the IDF level, as she also coordinates projects in the young program, I think, at the IDF. So, Maartje, it is up to you.
Thank you for the kind introduction. So, well, as already told, I am Maartje Roskams and I'm working at IDF Europe. And aside from that, of course, I'm living with type 1 diabetes for 9 years already. And I guess I have the perspective of a patient, but maybe now also another view on data as a nurse. But I must say that when people asked me to talk about data, I most probably think of, or even more on patient files and on the patient's rights or your right to look into your medical files, because from my perspective, you are always more than only the numbers that most of data give. So you're always more than only what your time in range is saying, or what your insulin pump results are saying, and what that data is saying. And also, from a perspective of a nurse, I would like to approach it maybe differently than just general data and numbers. But to be honest, I'm living with 2 chronic diseases, epilepsy and diabetes. And before I started studying nursing, I really did not have any clue about what is data, which data of me as a person living with diabetes and epilepsy is used, where I can I look into my medical file. I always thought that the data of what was collected from based on my life was ownership of the hospital, ownership of doctors, but I wasn't aware of the fact that I also have ownership of that data. And that was a great discovery for me when I started to study nursing, because I learned a lot about how you need to be careful with data, with patient data, how you need to carefully write reports, because the patient and the family have the right to look into what you wrote about your patient. And suddenly, well, it hit me that there's a lot of data also from me into the world, but where is it shared and what is happening with that data? So not only the numbers, but also all my clinical consultations, and I really wasn't aware of having ownership of that. And yeah, that was maybe still, I really, maybe I'm not busy enough with the data or where it's used, but it's interesting for me to know now that I can do way more with my own healthcare and with my treatment if I would have a better view or consent or gave consent on where the data is shared. So maybe an important thing too is that if I do not really know where my data is, studying or being a nurse or doing international work, then a lot of people don't know where the data is, if they gave consent for it or they didn't give consent for it, or the data is used. So I think there's a big problem, and there needs to be more education on privacy, GDPR, and what is happening with your medical files. So I think it's a very complex topic and important to have more knowledge about. And maybe I could have asked it earlier to my healthcare professionals, but when you are young, or even without being young, some people really don't mind the importance of having ownership of your data or knowing where it is shared. So to be honest, I'm even a bit scared talking about data in my medical file, of what I even would find of data when I was a child, or the things that were said about me during clinical consultations, because I never knew what was written down or what was used. And yeah, to give a more practical example of ownership of my own treatment, since a few years ago, I did not even know that it was on me to change settings in my insulin pump, because I thought it was only the responsibility of changing things in my file or changing things in my treatment. And it was only the responsibility, or that only the educators or the doctor had an ownership on doing that. So sometimes it brings you in difficult or dangerous situations, because a lot of healthcare professionals are also overwhelmed to look at your data, to look at your charts and stuff, and to make changes. But at the same time, you are also waiting for the response, and you are also having a lot of hypos maybe, or a lot of dangerous high blood glucoses for days, because some processes are really going slow. I also feel that data should be more centralized in one platform, or it needs to be easier accessible. Because if I want to read out my insulin pump, for example, I need to take 25 minutes to do so. I need to have a computer and USB connection, and not all Apple computers have that lately. So it's always a big deal to get my data online. Then you are asked to, okay, do you give your consent to use the data? And then you need to read a file of 3 pages where the data is used. And then I'm like, yeah, but who cares? It doesn't matter that people know that I have a lot of highs, that people know that I have a lot of lows, but it's way more important because that data that is used, it happens way more than only knowing that you have highs and lows or that your time in range is well. So a lot of people are also lazy when you need to give consent. When you have the chance to give consent, a lot of people are also not willing to read 3 pages and knowing what's happening with the data. So then loading up the data, receiving it, sending it to your healthcare professionals, it takes so much time. And when data would be more centralized or more easy accessible or sent out to healthcare professionals, it would be very beneficial in my treatment of diabetes. But then the question is, if it's all easy accessible and if you can send it at every time and at every place, where is the safety in always sending your data everywhere, and what are people doing with it again? So at clinical consultations, for example, when handling your treatment or your data, I think sometimes it's frustrating that healthcare professionals are just sitting behind the computer. You are telling your story, they are writing it down, but you don't have, you can't see literally see what people are writing, how your medical file is looking like. And it's a small thing, but just for healthcare professionals, turning the screen literally that you can look at, okay, what are they typing, how is my medical file looking like. It's just a small effort to do, to turn your screen to the person living with diabetes, but it gives them also the possibility to take action themselves, to think about their treatment and just not sitting and listening like, okay, I see on my charts, okay, my sugar is high. Okay, yeah, the chart is saying that I'm high. But if people help you using that data, you can have a better ownership or a better participation in your own treatment. So yeah, I think a lot of centralized data and stuff, it would be very beneficial, because if you use a certain device, then you need to give consent for that platform of that device. But if it's combined with another device, you need to give consent there. But the content is not even on the same platform. So also, I guess for healthcare professionals, on a diabetes clinic, when I was doing an internship, they needed 10 cables for 10 different devices. They needed 10 different software programs, and you need to be aware of all the programs and if data would be more centralized in, for example, one software program, also, I guess the healthcare system would be easier and it would go more quickly for every party. So for the healthcare professional, but also for the person living with diabetes or another chronic disease. So I think a lot of things are complex and a lot of things needs more clarification, or indeed a patient needs to have more education on GDPR and privacy, and also not 3 papers to read to know what's happening with the data, but just concrete information that also healthcare professionals need to give, so that patients are quickly educated about it. So that's what I thought of thinking of data and my perspective. That's what went through my head. I think you are on mute, Philip.
Yeah, sorry. Thank you, Martin. Indeed, very interesting to learn from daily life experience, and again, congratulations with your graduation. Indeed,